Okay. Now, I know there was a study for suvorexant, right, in patients with what? With Alzheimer's disease? And that's ongoing, as I understand it, or is that complete? Is this study done?
There was a poster presented at the American Academy of Neurology, and I think the lead author on that was Dr. Herring. So it looked specifically at the clinical I'm going to butcher this for a second.
They tried polysomnograph?
Thank you, polysomnograph. I was going to say polysomnograph or polysomnography?
PSG.
Yeah. What?
PSG.
Oh, PSG.
Just
Thank
wrap
you.
it up and call it PSG.
Thank you. PSG. So, and it actually used that in terms of looking at the implication of suvorexant on that in patients with Alzheimer's disease. The patient population with Alzheimer's disease were those with mild to moderate stage, and the interesting aspect of that is many were more in the mild stage. So the average mini-mental was about a 22. So, and I think, you know, as we have the experts on this panel know, as the disease progresses, sometimes the sleep becomes maybe a manifestation of other problems as well. But nonetheless, they saw an improvement in total sleep time about in difference, about 29 minutes. So, and again, we're seeing a range. Getting to kind of Sandy's point in terms of the next day, it didn't seem, the signal at least didn't seem to have an implication maybe on their cognition or that drowsiness the next day. But it's a short study. It was a 4-week trial. There's still ongoing enrollment. It was only about 142. They looked at some of the adverse events and of course the next time daytime somnolence, but the dropout was pretty low. So it's a poster. I haven't seen the whole publication, but it does give us something to look at in a population that we're caring for, especially if we don't see that implication on the next day. But I think we'll have to watch in terms of the implication on other safety parameters too.